do you deal with a population that have been operated already? And tell us a little bit about how you would treat them.
Yes. So a typical example, we'll talk about a peripheral joint condition first, since that, as I already mentioned, is probably one of the more common sources of chronic pain. Let's say somebody who has a chronic knee condition ends up getting a knee replacement, gets technically a very good surgery, recovers very well from the surgery, gets complete range of motion of the knee, which they did not have before. They walk very well. The wound is completely healed, but they still hurt. That's not an uncommon situation. It's not all the time, but once in a while that will develop, and I will often see somebody like that and discuss the options. The knee's been replaced, so there's no longer a joint to be a source of pain. Sometimes a small amount of pain medication will suffice, and I don't hesitate to treat someone pretty conservatively if they can get by with a small amount of pain medication. But once in a while that's not adequate or they don't tolerate it. There's a treatment area that I have used very successfully that involves targeting the damaged, painful sensory nerves around the joint with a technique that has a big name called radiofrequency ablation. Okay, so radiofrequency ablation involves using a special type of a needle that will destroy the tissue around the nerve that is the culprit. I do this a fair amount, and the knee is a very common target for this kind of condition.
So you're talking about selectively putting to sleep the non-functional tissues that are the source of the pain.
That's exactly right. Not just deadening it like you would with, say, Novocaine or numbing medicine, but actually destroying the tissue that the nerve passes through so that the nerve is disrupted. It's not a permanent solution because these nerves do have the ability and the tendency to grow back, but for a period of about 9 to 12 months it can provide excellent pain relief by disrupting the nerves that are causative.
And when that nerve grows back, it doesn't mean that it's going to grow back with pain.
That's right. Oftentimes the nerve will grow back slowly and will not be a source of pain when it grows back. But if it does grow back and the pain returns, the same procedure can be repeated. So this is an easily repeatable procedure. That's a simple 30-minute outpatient thing that does not involve cutting, stitches, any significant amount of rehabilitation.